Thank you so much. So nice to be here. My name is Patty Hillkirk, and I'm the founder and director of Camp Dreamcatcher. We provide therapeutic programs and educational programs to HIV/AIDS impacted youth. So that means kids who are HIV/AIDS infected themselves, come from a family member where someone is HIV/AIDS infected, or have a family member who's died from an AIDS-related complication. Over the past 27 years, we have served 6,000 youth, and our volunteers have provided over 300,000 hours of service. So our ask, we are requesting funding to help us identify youth from the greater Coatesville area to come to our camp session. And we would like to have 10 new campers from the Coatesville area come to the camp session, and the amount per camper is $714. So years ago, my best friend was diagnosed with HIV, and that's what got me started in this business. And I have a passion for it. I worked and volunteered with other organizations in Chester County in the late 80s when people were dying of AIDS. I'm a psychotherapist, and in 1995, I was watching a program on 60 Minutes about a camp in New York for kids impacted by HIV and AIDS. And something about that really touched my heart, and I felt I needed to get involved. And with a small group of people, we created Camp Dreamcatcher. And you can see some of the quotes from the kids on the slide. What they often say to me is this is the only place that they feel safe and they feel they can share their experience of HIV and AIDS. So the challenge really is the stigma still associated with the disease. So it's hard for us to identify new kids to come to camp. We partner with nonprofit organizations in the greater Coatesville area, like Family Service of Chester County, Project One. And even with that, we have a hard time finding kids to come to camp. So that's our challenge. The kids that come to our programs face many issues beyond HIV. 70% have experienced trauma, 50% have lost one or both parents, and 30% have been diagnosed with a mental health condition. 98% come from low-income households, and only 13% of those have access to affordable mental health programs in their own community. So really, our mission gap is the unidentified HIV/AIDS impacted youth. I can tell you that last year, 15 of the 28 campers from Chester County were from the greater Coatesville area. So we would like to increase that to 25 this year. We also acknowledge that racial disparities are prevalent in our public health systems and result in people of color being impacted by HIV, AIDS, and COVID-19 disproportionately when compared to whites. We strive to reduce barriers to mental health equity and physical equity so that children and families served by our programs will have full and equitable access that enable them to lead healthy lives. All of our programs are free, and we provide transportation to our programs. Once a child comes to our programs, and many of them are from large families, then they can all be involved with our ongoing programs. So after August, we have our Holiday Adoptive Family Program, we have mentoring programs, we have a teen leadership retreat, which is coming up in April, we have a college scholarship programs, so they can get involved in all of those. We also, during COVID, started an emergency gift card program. So our solution is our free therapeutic camp session, August 20th to the 26th. And this is what we do during the week. We offer 150 trauma-informed therapeutic programs. And these include psychotherapy, yoga, massage, acupuncture, wilderness-based therapy, animal therapy. We offer educational programs. We will offer 50 during the camp week. And these are programs on grief, HIV/AIDS, on career and college scholarship programs. And we bring out colleges to partner with our leaders in training and learn more about applying to college. We provide a safe, equitable, and inclusive program where campers and volunteers feel like they belong. That is our mission. And for the past 3 years, we've partnered with a company called S'more Melanin and have really done intense DEI work. Our trainings include sessions on trauma-informed programming, systemic racism, racial trauma, white privilege, and LGBTQ plus inclusivity and belonging at camp. Last year, we launched a new restorative justice program at camp, and we also give parents a week off without their kids, which is really nice. So the camp week budget is $117,750. The cost to sponsor 10 campers is $7,140. And our team, over 180 people come to camp and volunteer each year. And 70% of those have been doing it for well over 10 years. 98% of the youth and 70% of the volunteers are BIPOC. And last year, we were the first camp to receive the S'more Melanin Seal of Approval for our DEI efforts. This is my contact information. Thank you so much for allowing me to tell you about camp.
Patty, thank you so much for your presentation. I'm also a child of the 80s who grew up with AIDS messaging all over, and it's interesting to hear that there's still such a need now. So thank you for that information. I do have a question. In today's climate of data privacy and HIPAA, how do you find these students?
Well, a lot is word of mouth. 70% of the kids have been coming for over 10 years. But as hospital personnel, it's HIV case managers like Project One here in Coatesville. And we get kids from CHOP, from St. Chris, from Johns Hopkins.
Patty, I just first and most importantly want to thank you for, having that touch your heart and the hope and the positivity that you provide these kids. It's really incredible and so meaningful. I can speak from personal family experience that it just really makes such a difference in a child's life who is dealing with something so difficult. So thank you. I just wondered where you hold your camp.
Yes, so we are located in Kennett Square, is where our office is, and then I rent out different facilities. So the camp week, we hold at Camp Saginaw in southern Chester County.
Thank you again for the work you do and the fact that you're providing a safe place for our young people to address their issues, which is so important. In many cases, they don't have a safe place, or they don't have a perceived safe place. I like the fact that you also address the racial disparities that they're challenged with, and you're also looking at many other important topics such as trauma. The other thing I like to add is that it seems like your program is flexible. During, I guess, the COVID crisis, you had mentioned something about cards, trying to provide some extra income. So thank you again. Thank you for your work.
Just going to echo what everyone else said. Thank you for your service. I think, providing a safe haven for these children, you had said, I think 50% of them only have lost a parent. So you are filling this massive void for them is super admirable. Just a question. It's 1 week out of the summer, and it's overnight?
Yes, it's overnight. That's the camp session, and then we have year-round programs.
Awesome.
Thanks, and again, ditto to all that you've said. I remember a lot of what was going on in the 80s and how persons were ostracized. No one wanted to be near anyone, and certainly there wasn't the opportunity for young people to come together and to play and to have fun and to learn. So thank you so much for this. This sounds like a wonderful program.